Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Cory Calendine. He's an orthopedic surgeon. Today's Kevin MD article is Knee Replacement Marketing Undermines Informed Consent. Cory, welcome back to the show.
Well, thank you so much. We were just talking before. It's been several years. Kevin, it's good to connect back with you.
Wonderful. And I see you, like we talked about, all over social media, clearly doing well. And I love how you blend what you do online, of course, with your orthopedic practice. Your Kevin MD article, we talk about knee replacement marketing, something that we don't often talk about on this podcast. Now, why did you decide to write this particular tangent on Kevin MD?
Yeah, it really came to me as a patient consultation. A patient came in and she asked me about a branded surgical technique. So, like a trademark name, and she used it in the sentence correctly, and she knew when to ask for it and ask for it early, but she really didn't understand the term. She didn't know what she was saying. Even though she knew the name, she didn't know really the science behind it. And Kevin, you've done great for us in this field, bringing education to the patients where they are. Patients are going to find information. And if we don't do a good job educating, they come with the name, but not the substance. So that it just got me interested.
Yeah, so obviously I don't do orthopedic procedures, but there are a lot of branded procedures that people would see on social media, on television, and they would come to me with a particular condition and say, "Hey, what do you think about this procedure that I saw on television?" And I could only imagine in orthopedic surgery, there's just so many different types of procedures that patients get exposed to. And like you said, they know the name, but they don't know the science quite behind it, which is, of course, where you come in. In this particular instance, where did this patient find out about this particular procedure?
Right. Facebook community groups, of course. And so there are groups now, and I want to shy away from naming too many actual names here because these names are federally trademarked. And so we want to be respectful of what they're building. But yeah, so she came to me, she had done her research, she had read probably your blogs, Kevin. She had been through the internet to find the way that she could recover the fastest. And so if we rewind a couple of years, what's really happening is we used to use broad terms like minimally invasive surgery, right? I mean, minimally invasive sounds good. If I was a patient, I would definitely want minimally invasive surgery. The problem is that term doesn't mean anything. And we've taken it a step further to say, well, now it's an X approach or something, that's nondescript. So what I've tried to do in my patient education on YouTube and elsewhere, and hopefully through this article, try to really bring the substance behind it. So let's take knee replacement because that's really what we're talking about in the article. The concept is the approach that many people are using now is called the Subvastus approach. Now, Subvastus isn't very good for a billboard, right? It's not a real catchy name, but Subvastus means we come underneath the muscle. So we're able to do knee replacement now without cutting the muscle. Oh,
Mhm.
now you've connected. Patients can understand that for sure. So you've come under the muscle. You could do a knee replacement without cutting the muscle. If you don't cut the muscle, it doesn't have to heal. That leads to a faster recovery. That's what I wanted to bring attention to. We need to do a better job giving patients substance so they don't come in asking for some, oh, I want the I don't know, what would we call it? The purple and blue knee or something, the golden orange knee or whatever name that we would give it. We want to give them the reasons behind it and not cutting the muscle. That's where you can connect to education.
So, of course, over the last few decades, we've had direct-to-consumer marketing when it comes to medication, but now this is expanded, of course, to orthopedic procedures. Talk to us a little bit about the evolution of that. When has it become more prevalent that specific branded orthopedic procedures has become commonplace?
Yeah, I mean, for us, particularly in knee replacement, the example that started this article, it's really been in the last 5 years.
Hmm.
If you look up some of these branded terms now and you look under Google Trends, it outpaces some of the big company names. So, there are big company names in orthopedics, Stryker, Zimmer, DePuy, big company names now. But if you look at some of these branded procedural names, they're getting searched for way more than the companies producing the implants. And so we've seen that trend over the past 5 years or so. And I don't think it's all bad. I think the fact that patients have better access to information is great, but it comes back to where are they getting their information and what is the quality of the information we're giving them. On YouTube, Kevin, YouTube will, certify you to be a licensed provider. And I think that's very, very helpful. Here in ortho, what we're talking about with approaches, these are board certified orthopedic surgeons, but still the quality of the education isn't there. So it's not just certifying who it's coming from, but also making sure it has the right depth.
So let's talk about this particular case
Yeah.
where this patient came to you asking about this particular procedure. Now, was it appropriate for her underlying condition?
Yeah, what a great question, Kevin, because some patients do come in not appropriate for the procedure. It was completely appropriate for her. This approach we're talking about, the subvastus, where you come underneath the muscle to do knee replacement. One, she needed a knee replacement. Two, she was a great candidate for the subvastus approach. And so in her, she would have done well with said named procedure. But there are people that get offered a false expectation. Not everyone, for example, can have a subvastus approach. If there's certain deformities, certain shapes, certain body habituses that won't allow coming underneath the muscle. So in knee replacement, sometimes I have to cut the muscle. I don't want the patient to feel like they're missing out or getting something less than. We're just trying to customize the procedure to them. But for her, she was a great candidate for what she asked.
So, in terms of actual harms, so patients come in, they just get a 30-second synopsis of X surgical procedure, and then they come to you and talk about it. What are the actual harms to patients knowing what specifically to ask for or asking for what they see on social media to you?
Yeah. Well, we know this, Kevin, that patient expectations are directly aligned to how patients do. This has been shown again and again and again. So my concern is largely around if we give patients unrealistic expectations, or maybe even worse, like we were just talking about, they get their hopes up, their expectations up for one procedure of which they don't qualify for. That lowers their overall morale and, quite frankly, their ability to recover. There's a mental game to recover, and I don't mean that the patients are crazy or somehow impairing their healing. I mean they need to be empowered, and it's our job to empower them. So offering false hope, I think, is very dangerous. I think that's a real harm, and I think our ability to give patients realistic expectations is critical. This has been shown again and again in the published literature.
So, just so we're clear, because not everyone listening to this have maybe seen some of these placements, in
Yeah.
general, what are some of these branded orthopedic approaches or procedures? What exactly are they promising?
Yeah. Well, they're promising what every patient wants: less pain, faster recovery.
Mhm.
But again, the brand names, let's say it would be called Ready Knee or something like this. They'll
Mhm.
come up with a clever name, or Swift Knee. These are not names that I'm familiar with, but I'm just
Sure.
giving an example. So they're the Ready Knee or the Swift Knee. So the issue is they'll say faster recovery, and you'll be back to work in a week. Well, they may be based on what we were talking about, well-established techniques like the subvastus approach that some people are candidates for and some people aren't. And there is data to say that the subvastus approach helps you recover faster. But once you stick a name on it, patients subscribe all that goodness to the name and not the underlying cause. That's where I think the expectations can be mismatched.
Now, are we talking specifically about knee procedures? In the orthopedic world, what are some other common branded procedures that are being advertised to patients?
Yeah. Well, on the hip replacement side, virtually all I do is hip and knee replacement. So on the hip replacement side, and maybe you've even heard about this, Kevin, or your patients have asked you, the direct anterior approach. Now, this isn't a named brand, right? It's being
Mhm.
descriptive of the procedure, so I think it's more valuable. But when that came out, the direct anterior approach, we don't cut muscle, faster recovery. And even some of those marketing claims were ahead of the data. Now, the research has bore that out, and it just so happens that I do the direct anterior approach, and it doesn't cut muscle, and there is faster recovery in the published literature with lower dislocations. So that bore itself out, but marketing kind of came before the literature, which I
Mhm.
think is another thing that we have to be careful of. The difference in that scenario, Kevin, though, is the name that got signed up for was really a description of the procedure. And so I think at least it offers, okay, anterior, you're going to come from the
Mhm.
front, or you're going to at least figure out what that word means. I think that was a little bit more, oh, I think that was better for patients. It gave them a little bit more of a description as opposed to maybe a name that they can't connect, what the anatomy is.
You said earlier that sometimes the literature is not quite where the marketing is.
Right.
So, in general, with these procedures, and I know that in what I do in internal medicine, where the literature doesn't necessarily support the marketing, where are we with these branded orthopedic surgery procedures? In general, is the literature supporting what they're advertising?
Yeah. Unfortunately, not so much with these more names that I'm referencing in the article around knee replacement. Many of them are built on Subvastus approach, but there's literally no published data on, again, I'll use the names that, again, I don't know are real names, but the Ready knee or the Swift
Mhm.
knee. Now, is there published data based on the approach, the Subvastus approach, that are part of that program? Yes. But unfortunately, the branded procedural names for knee replacement, there's zero published literature on that. So
Mhm.
they're really borrowing the claims from the approach, which is the Subvastus. And again, I just think that's confusing. And patients will think, oh, if I don't get the brand name approach, I'll have a different outcome. But really, they're leveraging the good quality research based on the surgical approach, not the name.
So tell us about the spectrum of outcomes from this scenario. You have
Yeah.
patients, I'm sure, all the time come to you, perhaps asking for a specific procedure that they
Yes.
saw in media.
Yeah.
Now, tell us your approach of guiding through patients like that through that conversation. What's it like inside your exam room through that initial consult?
Yeah, I mean, for me, I think that there's a maybe a temptation to push back and be the physician that gives them all the answers, but I've actually adapted. I actually welcome the fact that they have looked around and tried to understand things. Now, obviously, ultimately I want every patient, certainly all my patients, to trust me, but I think it's good that they came prepared. So I would tell you in my exam room, one, I'm very receptive to what they've learned. I want to understand what their level of understanding is. And I've found actually that if you start from where they are, that they'll buy into whatever you say, even if it's opposite, even if it changes their perception, because they know you tried to meet them where they are. And that's our responsibility. We're never going to be good enough digitally to deliver that level of nuance, right? Because everything that somebody hears, they'll hear it differently, if you will. So that customization is always going to happen face to face. But how would I handle it? I'm very receptive to what they say. I start where they are, and then I try to give the reasons. And quite frankly, I think every surgeon should be receptive to that. If we as surgeons or us as physicians can explain in common terms good foundational reasons for what we do, well then, I think it's an opportunity for us to challenge our own beliefs.
Now, for the patients who may be listening to us right now, sometimes they see a 30-second ad on television or they scroll past a procedure or a branded procedure on Facebook. Tell us the type of questions they need to be asking themselves to determine whether this is something that may be right for them or not. What are some questions they need to be asking whenever they see an advertisement like that?
Yeah. Well, I tell my kids the same thing. If it sounds too good to be true, it probably is. So there are certainly some outlandish claims, although I don't think that's always true. But anything that sounds too good to be true, certainly be skeptical of. This comes up for us in orthopedics with stem cells. Everybody wants to believe that stem cells grow new cartilage and we don't need any more surgery. I would love that, but if it sounds too good to be true, it probably is. Stem cells just there's no supportive evidence there. But with regard to the approaches, I think you're trying to look for honest messaging, and I think most of us can see. If they say everybody gets back to work in a week, you probably know right away that that's not right. Because surgery and the recovery has to be customized. Maybe you sit at a desk. Maybe you're an industrial worker and you stand on a factory floor for 8 hours. So I think if you just listen to the claims that just don't sound, they try to be too generic and don't sound that they would match everybody, I think that that's probably a notable caution. And then ultimately, I think it's great that it brings people in to have the conversation with the physician, which I do want to hold sacred. Bring your questions of why do you do it that way? How many of these have you done? What are some other ways that you can do this procedure and why don't you do it that way? I think these are all very fair questions. I don't think any of us wants to be, under a lawyer's microscope per se, but I think questions in good faith. Asking the surgeon to give you reasons for why they do what they do. My guess is most all surgeons have a very good reason, and that is to deliver you the best care. They'll be able to explain it.
We're talking to Cory Calendine. He's an orthopedic surgeon. Today's Kevin MD article is Knee Replacement Marketing Undermines Informed Consent. Cory, as always, let's end with some take-home messages we want to leave with the Kevin MD audience.
Well, thank you so much. Well, my message would be you are the master of your own health. And so I encourage all your listeners to look around and educate themselves about what's going on with their body and try to articulate what's going on with their body. And then, and only then, find someone you can trust, a physician, a surgeon that will sit down and talk to you and customize the care to you. Every patient's different. I do nearly 700, 800 hip and knee replacements a year. Everyone is different. So one, be the master of your own care. Find someone you can trust. Build your own custom plan. Thank you, Kevin, for having me.
Cory, thank you so much for sharing your perspective and insight. Thanks again for coming back on the show.
My pleasure.